Did you know that about 1 in 4 people globally will have a stroke in their lifetime? That's a shocking statistic, but it's true. Stroke is the second leading cause of death and disability worldwide, affecting more than 15 million people every year. But what is a stroke and why is it so dangerous? A stroke is a medical emergency that occurs when the blood supply to a part of the brain is interrupted, causing brain cells to die. This can result in permanent damage to the brain and the body, such as paralysis, speech problems, memory loss, and even death. But what exactly happens in the brain when a stroke occurs? And how does it affect different functions of the body? To answer these questions, let me show you a simple and fun way to understand the anatomy and physiology of the brain and the stroke. Imagine that your brain is like a city, with different regions, roads, and buildings. Each region of the brain has a specific function, such as controlling movement, language, memory, emotion, and so on. Each region is connected to other regions by roads, which are the blood vessels that carry oxygen and nutrients to the brain cells. And each region has buildings, which are the brain cells or neurons that perform the function of that region. Now, imagine that a stroke is like a disaster that strikes the city. There are 2 main types of stroke, ischemic and hemorrhagic. An ischemic stroke is like a traffic jam or a roadblock that prevents blood from reaching a part of the brain. This could be caused by a blood clot or a plaque that blocks a blood vessel. A hemorrhagic stroke is like a burst pipe or a flood that damages a part of the brain. This could be caused by a weak or ruptured blood vessel that bleeds into the brain. When a stroke happens, the affected region of the brain does not get enough blood and oxygen, and the buildings or neurons start to die. This causes the function of that region to be impaired or lost. For example, if a stroke affects the region that controls movement on the right side of the body, the person may experience weakness or paralysis on the left side of the body. If a stroke affects the region that controls language, the person may have difficulty speaking or understanding words. The extent and severity of the damage depend on how long the stroke lasts and how quickly it is treated. The longer the stroke lasts, the more neurons die and the more functions are lost. The faster the stroke is treated, the more neurons can be saved and the more functions can be recovered. That's why it's very important to recognize the warning signs of stroke and call 999 immediately if you or someone else has them. By doing so, you can increase your chances of survival and recovery. The good news is that stroke can be prevented or treated if you know the warning signs and act fast. Hi everyone. Welcome back to Dr. J. Lim's Holistic Health Corner. I'm Dr. J. Lim, an academic doctor from the University of Cambridge. In this video, I'm going to show you how to recognize the warning signs of stroke days before it happens, and what to do if you or someone else has them. By knowing these signs and acting fast, you can save your life or the life of someone you love. So stay tuned and watch this video till the end, where I will reveal some simple and natural ways to prevent a stroke from happening. The most common warning signs of a stroke can be remembered with the word fast. F stands for face drooping. One side of the face may droop or become numb. When asked to smile, the smile may be uneven. This is because a stroke can affect the muscles and nerves that control facial expressions. The affected side of the face may also have a lower eyelid, a smaller pupil, or a droopy corner of the mouth. A stands for arm weakness. One arm may become weak or numb. When asked to raise both arms, one arm may drift downward. This is because a stroke can affect the part of the brain that controls movement and sensation in the limbs. The affected arm may also have difficulty with coordination, grip, or fine motor skills. S stands for speech difficulty. Speech may become slurred or difficult to understand. The person may be unable to speak at all. This is because a stroke can affect the part of the brain that controls language and communication. The affected person may also have trouble with reading, writing, or understanding words. Finally, T stands for time to call 999. If any of these symptoms are present, it's time to call 999 immediately. This is because every minute counts when it comes to treating a stroke. The sooner you get medical help, the better your chances of survival and recovery. Delaying treatment can lead to more brain damage, disability, or death. Some other symptoms that may indicate a stroke are 1. Sudden loss or blurring of vision in one or both eyes, which could be caused by a blockage or bleeding in the blood vessels that supply the eyes. 2. Being or feeling sick, which could be a result of increased pressure in the brain due to a stroke. 3. Dizziness, which could be a sign of a stroke affecting the brainstem or the cerebellum, which are responsible for balance and coordination. 4. Confusion, which could be a sign of a stroke affecting the frontal lobe or the temporal lobe, which are involved in thinking and memory. 5. Difficulty swallowing, which could be a sign of a stroke affecting the brainstem, which controls the muscles involved in swallowing. 6. A sudden and very severe headache resulting in a blinding pain unlike anything experienced before, which could be a sign of a hemorrhagic stroke, which is caused by bleeding in the brain. 7. Loss of consciousness, which could be a sign of a severe stroke that affects a large area of the brain or causes increased pressure in the skull. These signs indicate that a part of the brain is not getting enough blood and oxygen and needs urgent medical attention. The faster you call 999, the faster you can get treatment that can save your life and reduce the damage caused by the stroke. But how can you recognize the warning signs of stroke days before it happens? Well, there are some other signs that may appear up to a week before a stroke, and they are often overlooked or ignored. These include a severe or unusual headache that may be different from any previous headache. This could be a sign of an impending ischemic stroke, which is caused by a blockage in a blood vessel that supplies the brain. The headache may be sudden, intense, or throbbing, and may be accompanied by nausea, vomiting, or vision problems. A transient ischemic attack, also known as a mini-stroke, which has the same symptoms as a stroke but lasts for a short time and does not cause permanent damage. A TIA is a serious warning sign that a more severe stroke could happen soon. A TIA may cause temporary weakness, numbness, or paralysis on one side of the body, difficulty speaking or understanding, confusion, dizziness, or loss of balance. These signs are often ignored or dismissed as something minor, but they should not be taken lightly. They are signals that something is wrong with your blood vessels in your brain, and that you need to see a doctor as soon as possible. Even if these signs go away, they may come back stronger and lead to a major stroke. So how can you prevent a stroke from happening? The best way is to follow a healthy lifestyle, such as 1. Eating well. Choose foods that are low in salt, sugar, and saturated fat, and high in fruits, vegetables, whole grains, and lean protein. This can help lower your blood pressure and cholesterol levels, which are major risk factors for stroke. 2. Exercising regularly. Aim for at least 150 minutes of moderate physical activity per week, such as brisk walking, cycling, swimming, or dancing. This can help improve your blood circulation and heart health. 3. Quitting smoking. Smoking damages your blood vessels and increases your risk of stroke by 2 to 4 times. If you smoke, quit as soon as possible. There are many resources and support groups available to help you quit smoking. 4. Managing your health conditions. If you have diabetes, high blood pressure, high cholesterol, or atrial fibrillation, make sure you take your medications as prescribed and monitor your levels regularly. These conditions can increase your risk of stroke if they are not well controlled. By following these tips, you can reduce your risk of having a stroke and improve your overall health and well-being. Thank you so much for watching this video and learning with me. I hope you found it useful and informative. If you did, please give it a thumbs up and share it with your friends and family. You never know when this information could save someone's life. Also, don't forget to subscribe and turn on the notifications bell, so you won't miss any of my new videos. You can also check out my previous video here, where I reveal 3 natural remedies that can reverse atherosclerosis. If you have any questions or comments, please leave them below and I'll try to answer them as soon as possible. I love hearing from you and getting your feedback. Thank you again for your support and for joining me on this journey of holistic health. I'll see you in the next video.